Hi, everybody. It's Dr. Mildred, your board certified pediatrician and children's behavioral coach. I coach parents of children with challenging behaviors to better support and manage them. All right, guys. So today I'm coming to you to talk about autism, which is a very serious condition. Okay. It's also known as autism spectrum disorder, or ASD. It is characterized by difficulty with speech, social skills, repetitive behaviors. Okay, that's the start. It's a combination of genetic and environmental factors that lead to autism. Okay, there has been in the past some talk about vaccines being the cause of autism, those kind of things. There have been several studies that have proven that that's untrue. So it's a combination of genetic and environmental factors. Okay, it affects 1 in 59 children, so pretty common, unfortunately. You can also have sensory issues that go along with autism. So kids have issues with sights, sounds, taste, smells, touch, even sometimes. It can be diagnosed by the age of 18 months, but often doesn't get diagnosed until later, most commonly between the ages of 2 and 3. And then, of course, there are kids that get diagnosed later with autism as well. The earlier the diagnosis, the better off, as we talked about on our last show, that no matter what the diagnosis, early detection and evaluation and treatment is always going to be best. And that stands true for autism as well. So let's talk about some of the symptoms of autism. So babies can start to show symptoms as early as 6 months. Even some babies 2 to 3 months, you can notice some things, but more commonly 6 months to around 2 years is the most common where parents start to pick up things. Because if you really think about it, babies don't do a whole lot when they're 2 months, 3 months, a month old, that kind of thing. So that's why some of those things aren't picked up, because babies aren't expected to do some of the things that go along with autism. But anyway, a decrease or no eye contact is one of the things you have to look out for. A baby that's not smiling or very few smiles. Most babies start smiling at around 2 months old. Now, some babies smile before that when they sleep and that kind of thing, but most babies in general start smiling back at you at about 2 months of age, and then they should continue to smile at you. Okay, so a baby that's not smiling, that's not making any eye contact, that's concerning. A baby that doesn't give you any facial expression. Like you don't see any excitement when they see you or see their bottle or something like that. You just get a baby with just a flat face that doesn't give any facial expression. That's also concerning. A baby that or older child that around a year or so that doesn't point or wave. Okay, those can be early signs and things that can be warning signs. Kids that always want to play alone and don't like to play with other kids, don't like to be around people, those are also can be some warning signs or symptoms of autism. Kids that repeat themselves over and over, repeat certain phrases and words over and over. We call it echolalia. They just keep repeating words over and over. Those can be signs, that can be a sign of autism. And so that needs to be taken seriously and evaluated. A baby that's not making any sounds, no babbling, is definitely, because as you guys may know, or if you don't know, some kids with autism are nonverbal. So if you have a child that's not making any sounds, as I said, not making eye contact, there's something wrong. That is a basic thing that kids should do, is start making sounds. Okay, even little tiny babies make sounds, right? So if you have a baby that's 2, 3, 4 months old and not ooh and ah and making those vowel sounds, that's an issue. So that needs to be evaluated. Okay. Also, kids that have a fit and resist change. So whenever there's a change, a minor change in the environment or their surroundings, they just freak out and just melt down. That's also concerning, okay? Repetitive motions like rocking, hand flapping, those are also concerning. So a kid that just sits over and over and just rocks and rocks and rocks, or does hand flapping. Okay, those are also things that you should be concerned about, and it needs to be evaluated. let's see, unusual reactions to taste or eating. They tend to be very particular about the things they eat and the textures. So you have to be very and you know, it's a fine line, because some kids are very picky. They only want to eat junk, that kind of things. That's not uncommon in a 2-year-old not to have a good appetite or to have a good variety of things that they eat. So that's not so uncommon. But the kids that they only eat, for instance, chicken nuggets, so they only eat macaroni. They won't try new things. They spit everything else out. They are not willing to try new things, no tasting. They just eat 2 or 3 things and that's it. And you can't get them to try. They melt down if you try to get them to do anything else. They often spit food out, which, like I said, kids that don't like certain food or textures, and it can be normal for some normal kids that not like certain textures. Like kids tend to not like a lot of meats, especially the stringy meats. So that's not uncommon. But just a child that is very specific and very picky and just won't eat but 1 or 2 things, that's concerning and needs to be evaluated. Let's see. So let's talk about when these things should be picked up. So as pediatricians and primary care providers, we often do something called an MCHAT. If you guys think about when your child was about 18 months old, if you have a young child, if you remember, if you have an older child, around about 18 months, they had you fill out a form that asks you certain questions about your child's behavior, if they got upset with everyday noises, do they line things up, do they wave, did they look at you, did they try and pull you and get you to look at what they're looking at, those kinds of things. That is called an MCHAT, okay, MCHAT, and that is our screening tool that we start at 18 months and then again at 2 years old to look for possible signs of autism. So MCHAT, so that's what happens at your primary care office, and that should happen at 18 months and again at 2 years old, because that's when autism is most commonly picked up, as around the 2-year-old mark. But like I said, it can be picked up as early as 18 months, and you can get some clinical signs and clues even before then, when a child is younger, if you don't get some of those things we were talking about, like babbling and eye contact, those kinds of things. So definitely 18 months, they should be screened officially. So that 18-month visit, that 2-year-old visit, well child visits are very, very important for autism screenings. Now, some insurances don't actually cover autism screenings, and especially when I have worked in private practice, and I get some parents that refuse the screenings because they don't want to pay the fee. But guys, it is very important to get those screening tests done, even if you have to pay for them. They're not all that much. I think $15, $20, which I know for some that can be taxing. But I will say it's worth it to know whether your child has autism or not, because early diagnosis, like I said, and early evaluation and treatment is going to give your child the best to reach their best potential. So early diagnosis and early treatment, okay? So kids that are diagnosed under 3 can actually get early interventional services. So those are the services that happen before they start school. If your child is between the ages of 3 and 21, then they would get services through the school system, okay? So let's talk about some of the services that are available. So as I said earlier, kids with autism often have trouble with communication. So speech therapy is something that helps and is very helpful if it started early. Occupational therapy, which is different than physical therapy. Occupational therapy helps kids with their activities of daily living. So things like buttoning their shirt, washing their hands, kind of the activities, writing, those kind of things. So occupational therapy differs from physical therapy. So starting occupational therapy can really give your child a head start and get them the best and make sure that they live up to their potential. They also have behavioral therapy, because as I said, autism comes with a lot of unusual behavior behaviors like the flapping and the rocking and no eye contact and always wanting to play alone. So if we thought some behavioral therapy, starting school early and exposing kids to social interactions, because they often have a lot of trouble interacting with other kids and want to be by themselves. So social skills training is also another therapy that they can begin that could be very helpful. Sensory, as I said, kids with autism often have issues with sensory. So a touch to them, some kids don't like to be touched. They don't like to be hugged. Their body perceives it different than like I would. So those are called sensory issues, and they actually have therapy that help them with sensory issues. Some kids with autism, because of the meltdowns and how upset they get and screaming, can also use some anger management therapies as well. So the autism cannot be cured, let's say that, okay, but it can be helped through treatments, okay? So the role and goal of treatment would be to reduce symptoms and then support kids' development and their learning, because they can still learn, they can still be active members of society, they can still contribute, they are a blessing, they still make us smile, they still make us laugh, and often autistics have special gifts. Some, if you guys remember the movie Rain Man, okay, he was autistic. So his unique gift was numbers, if you remember correctly. So autistics have lots to offer and lots to give. We just have to find their gift and use that. They can often have jobs. Some of them, you have to kind of tailor the jobs based on their gifts, because everybody, just like anybody else, autistics are not all the same. Okay, it's a large range. You have some autistics that are very high functioning, and those are known as Asperger's, so they are the least affected. And then you have all the way up, like I said, it's a spectrum of disorders where you have a child that doesn't speak at all. Okay, so it's a large array or a large spectrum of a disorder, and a child can be anywhere within that, and so therefore they can have gifts anywhere within that spectrum as well. So the main function of therapy is to decrease their symptoms and to make sure that they're learning, and then we help them to fit into society as best as possible. Okay. Other things that can go along with autism, kids can also have, on top of the autism, have ADHD, have ADD, which is attention deficit disorder or attention deficit hyperactivity disorder. They can have OCD or obsessive compulsive disorder, and that's kids that like constantly wash their hands, constantly want to clean, constantly want to sweep, constantly want to vacuum. So they have tendency to want to clean a lot. Okay, so kids can often show those type of characteristics in addition to their autism. So there can be a lot of associated symptoms that go along with other disorders that also go along with autism. Some kids have extreme anxiety. Okay, that can be really, really helped by starting school early and starting therapies earlier. They can have severe social phobias and school phobias and just being around people. A lot of phobias. So the earlier we start the intervention and we introduce them to being around people and being in social situations and different environments, they do so much better. Okay. So there are some medicines, the therapies are going to be your first line, and that's where you're going to get the meat of helping them to be the best that they can be. But also there are some medications that help, because kids with autism often melt down very easily. They can become very angered and agitated. They can hit themselves. They can scream for hours, cover their faces. They can, because of their sensory issues, some of them have issues with pain and like the feeling of pain and can inflict harm on themselves. Okay, so that's going to be important. So the earlier we can get these therapies started to help them, the better. Okay, so some medications, antipsychotics, and I know that sounds crazy, but through research and trial and error, we found that some of the antipsychotics can be very helpful in autistics to kind of keep some of those tantrums and meltdowns to a minimum. Kids with autism also have a lot of sleep issues and sleep disturbances, okay? So they don't sleep. They can sleep an hour or two a day, and the rest of the time they're up, which can be very stressful on families, okay? To have a child, you don't want to leave a child unattended. Just like any other child, you don't want to leave a child unattended. So having a child that only sleeps an hour or two a day it can be scary, okay? So sleep aids, some natural, some prescribed, can also help. And then there's some other medications that have a side effect that makes kids sleepy that were approved for other things that we actually use to help kids, autistics, sleep better. And also not just autistics, but sometimes the kids on ADHD medications can have trouble sleeping. And so we also use some of these agents to help them with sleep. So once again, guys, my big takeaway points: autism, early diagnosis. As we talked about earlier on a previous live, is we talked about guilt, we talked about shame, we talked about denial. Okay, so a lot of times the reason why kids don't get an early diagnosis of autism is because parents and families are in denial. They know something is different about their child, but they're scared to get that diagnosis, and they're scared about what that will mean for their child. But once again, I'm going to say early diagnosis, early treatment is what's going to make the difference. And the difference in a few months, and for some kids that have a severe delay in diagnosis, a few years, you don't get to get that progress back. That is lost, okay? So early diagnosis. So if you notice any of the things that I said earlier about not talking, not making eye contact, a child that always wants to play alone, that gets upset with minor changes in environment, a child that lines things up, a child that flaps their arms or constantly rocks, just abnormal behaviors, they just get upset, that's out of proportion to what's happening. Those are all clues that you have to get that child checked out to make sure. Listen, sometimes family and friends try to tell people and give them hints in a nice way that something may be wrong. And oftentimes parents ignore that because they just don't want to deal with it. And if you guys know the number of times that I've had parents, that even I or my colleagues have said, hey, we have concerns. We think you need to go get checked out. I think we need to be tested. We need to refer. No, I don't want to do it right now. I'll wait till next visit. Well, sometimes, with the well child visits, it can be 4 to 6 months before we see you again. So that time that is lost cannot be replaced, and we can't get it back, and that progress cannot be replaced. And it's so important for us to help these kids to be as great as they can be, okay? And that comes from the early therapy. So denial is a big issue, and no parent wants to feel like they're the reason why their child isn't doing as well as they could have, okay? So it's hard. This is one of those hard parts about being a parent. Discipline is one of the hard things, and also if you have a child that is not acting normally and having to face that. But as parents, it's our job. As primary care providers and pediatricians, it's our job to tell you guys these things. We're not saying these things to be mean. We're saying these things to jump on it early. And sometimes it may not be autism, but maybe it's something else that still needs therapy, or maybe it might not be anything. And maybe your child is just one of those children who walked early and developed motor skills early and didn't develop as many language skills. It could be nothing, but it's better to know than not know and get that early intervention. So, does anybody have any questions that I can answer about autism today? And thank you guys so much for joining me and for watching. Well, if you don't have any questions that you can think of now, please, you can always go back and add them in the comments, and I'll be more than happy to answer them. But autism is a big deal, guys. And as you heard me say, it is in 1 out of 59 children. So that's pretty common, and it is and can be a very devastating diagnosis. And the other thing, let me say this as well, there is a shortage of developmental pediatricians that do a diagnosis. There's a shortage of psychiatrists. There's a shortage of psychologists. So the medical community is doing its best to try and increase resources for families, because it can take a year or 2 years to get in and actually see a behavioral developmental specialist. So once again, that's time lost. So things can be done even before you have the diagnosis. We can start. We can order speech therapy. We can order occupational therapy as primary care providers. We don't have to wait on that diagnosis. We can order speech, we can order occupational, we can order behavioral therapy, we can order those things while we're waiting on the diagnosis. So please, if we tell you guys it's going to be a long wait for the diagnosis, don't let that deter you. We can still start therapies early, okay, and get these children some help and get them some therapies even before a diagnosis is made. So even if a diagnosis is suspected clinically, we can start therapies early. But once again, parents, guardians, you have to be willing to let us do our job and let us have these children evaluated and let us make the referrals and actually use the specialists and use the referrals that we're sending you guys to. So once again, I'm Dr. Mildred. Please connect with me across social media at Dr. Mildred's Peds. That's Dr. Dr. Mildred, Mildred, Peds, Peds. Your kids deserve it. Thank you for joining me. See you next time.